Yeah, you're exactly right, Kurt and Barbara. And what they describe behind these walls here at Sentara Norfolk General, as well as the other 7 Sentara hospitals across Hampton Roads, was really heartbreaking to hear. These doctors and nurses, they're coming out with that stern message, as you mentioned, but they're also wearing their emotions on their sleeves as they describe treating these incredibly sick COVID-19 patients and working desperately to save their lives. A rare look inside the ICU inside Sentara Norfolk General Hospital.
Already have an N95 on. I'm good, Val, thank you. And then another mask on top of it.
Doctors and nurses gearing up to make the rounds inside the intensive care unit, crammed full of terribly sick COVID-19 patients.
The more striking thing for me is just how young they are. They're 40 years old, they're 30 years old.
18 months ago, they were treating the elderly for COVID. Now they're working to save normally perfectly healthy individuals, the Delta variant overtaking their bodies.
They require such 100% oxygen, they can no longer get up and go and use the restroom or brush their teeth. They have to get somebody in there to help them to use a bedside commode. You know, that's something that someone who is 40 years old is just not used to doing.
Doctors tell us nearly all of those who are being treated share something in common.
The majority of people that are coming into the hospital being admitted for COVID, yes, are unvaccinated, between 80 and 90%.
538 patients are in ICUs across the Commonwealth. At all 12 Sentara hospitals, the ICUs are at capacity. More patients than beds.
We've got patients in every little nook and cranny that you can think of.
And they're staying in the hospital longer and longer, needing intensive treatment.
You're talking about probably, a month to 2 months in the hospital dealing with this illness.
The emotion of treating the sickest of patients taking a toll on these frontline heroes, as well as the dreaded conversations.
We are exhausted. Do you want us to do chest compressions on you? Do you want us to put you on the ventilator? Do you want to continue to struggle to breathe? Or are you wanting to give up the fight and be made comfortable? These are decisions that they have to make every day.
These men and women taking the oath to care, no matter the vaccination status, however, pleading with the public watching to get the shot.
We have seen a number of unvaccinated folks who, as they're getting intubated, when they come off of the vent, are begging to get the vaccine because of how bad that illness has and how intensely it affected them.
Certainly a grim situation, as you saw and heard there. Another issue, the emergency rooms. You've got the COVID patients, the increased COVID patients coming in, coupled with those who just need regular emergency care. And as you guys said it earlier, Kurt, the emergency rooms, they're taxed and they're crushed. Some area hospitals seeing wait times of up to 4 to 5 hours. We're live in Norfolk this afternoon. Chelsea Donovan, News 3.